Hey everyone, today we're talking about one of my favorite tools for relieving jaw pain, headaches, and generalized tension. It's called the Aqualizer. It looks like this. So it comes packaged look like this, and we'll talk a little bit more about the specifics of it pretty soon here. For those of you who don't know me, I'm Dr. Priya Mistry, and I'm a TMJ dentist with a practice in Vancouver, Washington. At my practice, we are dedicated to helping those suffering from TMJ disorders. If you've ever struggled with TMJ discomfort, clicking or popping in your jaw, locking episodes, tension headaches, neck pain, ear pain, stuffy ears, dizziness, any of those things that just won't go away, this little device right here may be able to help. Be sure to hit that like button, subscribe to my channel, and let's dive right in. So what is an Aqualizer anyway? The Aqualizer is a small, soft, water-filled oral splint that fits over your back teeth, way in the back. It might look simple, but it's based on powerful science. It's what's called the hydrostatic oral splint, meaning it uses water to automatically balance your bite. Pretty genius, in my opinion, and in my mentor's opinion. He actually made a minor attempt to buy the company many years ago. He believes so much in the Aqualizer, and I always have a gazillion of these in my office. Unlike a hard acrylic night guard that usually replicates your exact bite, where your teeth come together in full contact, the Aqualizer actually lets your muscles find their own natural relaxed balance point. So instead of forcing your bite, it lets your body guide the alignment. And that's what makes it so effective. Pretty cool, huh? So how does it work? When you bite down on an Aqualizer, the water inside the pads shifts side to side. This means your muscles aren't fighting uneven pressure anymore. They can relax and self-correct naturally. Think of it like a waterbed for the muscles of the head, neck, and jaw. That is frequently how I describe it to my TMJ patients. A waterbed for the muscles of the head, neck, and jaw. When your bite is unbalanced, your jaw muscles send constant stress signals to your nervous system, which can lead to pain, clenching, headaches, lots of different things. By balancing the bite pressure, by putting the muscles in their happy place, the Aqualizer turns off those stress signals almost instantly and can help relieve pain temporarily. Think of it like walking on level ground after being tilted on a hill. Your muscles can finally rest. So who can benefit from an Aqualizer? Here are the most common symptoms that I found an Aqualizer to help with. TMJ, or jaw joint pain. Those who clench and brush their teeth and have jaw tension or stiffness because of it. It can help with those symptoms. It can help with headaches and migraines, jaw fatigue and soreness, ear pressure or ear fullness related to the bite, and neck and shoulder tension. I've even seen it help with dizziness. If you've ever felt your jaw just doesn't fit right, or you wake up sore from clenching, the Aqualizer can give you fast feedback and often instant relief. All right, let's talk a little bit about how to actually use it, and I'll put one on and show you what it looks like when it's in place. So the Aqualizer comes in this package, and I'm gonna go ahead and open this up and take it out of here. So it comes in here. That clear part there is the actual Aqualizer. And behind here, there's instructions on how to place it in. You don't have to see those clearly. I'm gonna show you guys right now. So to take it out, you just kind of pull it out of the straps that are holding it in. Then to place it in, you take the water pads. So I'm gonna hold this up and show it to you. This is what it looks like, and you can see those two pads right here and here are filled with sterile water. And when your teeth rest gently against them, it serves as a waterbed for the muscles of your head, neck, and jaw. These water pads sit over your back teeth. You just place it over your upper teeth, bite down softly, and you'll feel the cushion of water underneath your molars. As you move or swallow, the water shifts slightly, and that's exactly what allows your bite to balance. You can talk lightly with it in, you can drink water, but it's not made for eating. So if you eat, you gotta take it out. Most people wear it for a few hours at a time, or as directed by your dentist, to let your muscles reset and relax. And honestly, for many patients, the feeling of immediate relief is pretty eye-opening. I'm gonna go ahead and demonstrate how to put this in. So when you take it out, you bend the water pads toward each other. So you bend it in like an arch or horseshoe shape, and these water pads are bent towards each other. So then you take it with the water pads bent toward each other and you put it in your mouth so the pads are way back in the corners of your mouth, so way in the back. I'm going to go ahead and place it in. Once I put it in, you're going to see me pull my upper lip over this part of it. And there, it's in. So you can kind of talk with it. You're definitely going to sound and look a little bit funny. I'm going to take it back out. But once it's in, you want to put gentle pressure on these water pads. So lightly bite. Don't clench hard against them. And when you do that, this helps the muscles to start to relax. It helps them start to balance, and it helps them start to kind of snap out of their dysfunctional state, because that's usually what's causing the pain. So now you might be thinking, how is this different from a regular night guard or a TMJ orthotic? So again, the way it works is the Aqualizer uses fluid balance. It adapts to your natural muscle movement instead of restricting it. So that flexibility lets your muscles find the most comfortable, neutral position. It's like standing on a supportive waterbed instead of a hard floor. Our body will distribute weight evenly, and then the tension melts away. Pretty amazing, huh? So the Aqualizer is often used as a diagnostic or therapeutic tool. If you feel relief while wearing it, that tells us your symptoms are likely bite or muscle related. We then use that feedback to design a more customized treatment plan, whether that's bite therapy or a long-term TMJ orthotic. Most people notice a difference within minutes or hours. I've had people put this in and say, that feels so much better immediately, because it takes the pressure off the joints and it helps to relax the muscles pretty fast. But remember, the Aqualizer, it's temporary. It is meant to guide your healing, not replace full treatment. I've had patients walk in with severe tension headaches or jaw pain that's been going on for years. And within minutes or even seconds of trying the Aqualizer, their muscles finally relax. It's one of those small tools that can make a big difference in understanding what your body needs. Now, keep in mind, it doesn't work that way for everyone. There are some people who wear it who don't notice any relief, or who can't tolerate having something that's not a custom fit in their mouths. The more you wear the Aqualizer, the rougher the plastic gets, and the more deflated the little water pads become. So it becomes less and less effective and more rough as you wear it. So it's not a diagnostic tool for everyone. It doesn't help everyone feel relief, but it does help the majority of my patients feel better, at least short term. So to sum it up, the Aqualizer is a simple water-filled splint that helps your jaw find its natural, balanced position. It can relieve TMJ pain, headaches, and tension, and it helps us identify how to get your jaw working comfortably again. So how can you get one? My understanding is that the Aqualizer company does not sell directly to consumers. You would have to get it from a dentist. And this is really for the best, because your wearing of it should be very short term, and it should be monitored by a dental professional. So please, please keep in mind, you should not wear an Aqualizer long term. You should not get it without the supervision, I guess, in wearing it of a dentist. This is mainly a diagnostic and short-term palliative appliance. So I sincerely hope that you guys learned something. The Aqualizer has been so helpful in my practice. If you're a dentist and you're watching this, please be sure to order some of these for your patients that come in with pain or will come in with pain in the future. It's always helpful to have these handy. You can store them in your freezer. If you have any questions, sound off below. And remember, my friends, you can never have TMI about TMJ. Thank you.